Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is Erythrocyte Sedimentation Rate or ESR. So what we will discuss today, we will discuss about the definition, determination methods, then normal values, then significance of determining the ESR, then variation of ESR, and then factors affecting ESR. So let us start. So first of all, what is the definition of ESR? Erythrocyte sedimentation rate or ESR is the rate at which the erythrocytes settle down. Normally, the red blood cell or RBC remains suspended uniformly in circulation, and this is called suspension stability of RBC. So, what is suspension stability of RBC? The RBC remains suspended uniformly in the circulation. So, this is known as the suspension stability of RBC. And if blood is mixed with an anticoagulant and allowed to stand on a vertical tube, then the red cells settle down due to the gravity with a supernatant layer of clear plasma. And ESR is also called sedimentation rate or SED rate or Bernanke reaction. And it was demonstrated by Edmund Bernanke in 1897. So, what is ESR? Erythrocyte sedimentation rate is the rate at which the erythrocytes settle down. And normally the red blood cell remains suspended uniformly in the circulation, and this is called suspension stability of RBC. And if blood is mixed with an anticoagulant and allowed to stand on a vertical tube, the red cells settle down due to gravity with a supernatant layer of clear plasma. And this is the ESR methods. And ESR is also called sedimentation rate or SED rate or Bernanke reaction, and it was first demonstrated by Edmund Bernanke in the year 1897. So, how to determine the ESR? There are two methods to determine ESR. One is Westergren method and one is Wintrobe method. So, let us start with Westergren method. In Westergren method, a Westergren tube is used to determine the ESR. What is a Westergren tube? The tube is about 300 mm long and opened on both ends. You can see a diagram. This is the diagram. This long tube, this is Westergren tube. You can see the A diagram. Okay. Now the tube is 300 mm long and opened both ends, and it is marked 0 to 200 mm from above downwards. And Westergren tube is used only for determining the ESR. And 1.6 ml of blood is mixed with 0.4 ml of 3.8% sodium citrate, which is a anticoagulant, and loaded in the Westergren tube. The ratio of blood and anticoagulant is 4:1. The tube is fitted to the stand vertically and left undisturbed. The reading is taken at the end of 1 hour. So this is the method of Westergren. What is the method? 1.6 ml of blood is mixed with 0.4 ml of 3.8% sodium citrate, which is the anticoagulant, and loaded in the Westergren tube. And the ratio of blood is to anticoagulant is 4:1, and the tube is fitted to the stand vertically and left undisturbed, and the reading is taken at the end of the 1 hour. Now we will discuss about the Wintrobe method. In this method, the Wintrobe tube is used to determine the ESR. So what is Wintrobe tube? Wintrobe tube is a short tube opened on only one end, and it is 110 mm long with 3 mm bore. And Wintrobe tube is used for determining of ESR and PCV. It is marked on both sides. So you can see the diagram of the both tube. One is Westergren and one is Wintrobe tube. So on the both side, and one side is marked from 0 to 100 for ESR, and on the other side it is from 100 to 0 for PCV or packed cell volume. And 1 ml of blood is mixed with anticoagulant ethylenamide EDTA. The main anticoagulant is EDTA, and the blood is loaded in the tube and up to 0 mark, and the tube is placed on the Wintrobe stand, and the reading is taken after 1 hour. Now normal values of ESR. By Westergren method, in males it is 3 to 7 mm in 1 hour, and in female it is 5 to 9 mm in 1 hour, and in infants it is 0 to 2 mm in 1 hour. And in Wintrobe tube, in males it is 0 to 9 mm in 1 hour, in female it is 0 to 15 mm in 1 hour, and in infants it is 0 to 5 mm in 1 hour. Now significance of determining the ESR. So ESR is an easy, inexpensive and non-specific test which helps to diagnosis as well as prognosis. So it has both value. One is diagnostic and prognostic. and it is non-specific because it cannot indicate the exact location or cause of disease, but it helps to confirm the diagnosis. Prognosis means monitoring of course of disease and response of the patient to therapy. Now, determination of ESR is especially helpful in assessing the progress of patients treated for certain chronic inflammatory disorders such as pulmonary tuberculosis, rheumatoid arthritis, polymyalgia rheumatica. It is an inflammatory disease characterized by pain in shoulder and hip. Then temporal arteries. So what are the diseases we have discussed? One is pulmonary tuberculosis, one is rheumatoid arthritis, one is polymyalgia rheumatica, and now next one is temporal arteritis. Now variation of ESR, physiological variation. Age. ESR is less in children and infants because of more number of RBC. Sex, it is more in females than male because of less number of RBC. Menstruation, the ESR increased during menstruation because of loss of blood and RBC. Pregnancy from third month to parturition, ESR increases up to 35 mm in 1 hour because of hemodilation. Now, the pathological variation. ESR increases in diseases such as the following condition: tuberculosis, all type of anemia except sickle cell anemia, then malignant tumors, rheumatoid arthritis, rheumatic fever, liver disease. And ESR decreases in following condition like allergic condition and sickle cell anemia, then peptone shock, then polycythemia, then severe leukocytosis. We have discussed in one video about polycythemia in very details. You can see that video also. Then factors which affects the ESR. So what are the factors which affect the ESR? That are, one is specific gravity of RBC. When the specific gravity of RBC increases, so the cells become more heavier and sedimentation is so fast, so ESR increases. Then Rolex formation increases in ESR. Increase the ESR, globulin and the fibrinogen accelerate the Rolex formation. Then increase in size of RBC. When the size of RBC increases, or macrocyte, the ESR also increases. Then factors decreasing ESR: viscosity of blood. Viscosity offers more resistance for settling of RBC. So when the viscosity of blood increases, the ESR decreases. Then RBC count. When RBC count increases, the viscosity of blood is increased and ESR decreases. And when the RBC count decreases, ESR increases. So this is our today's topic. We have discussed ESR, which is a short topic and which is an also important topic. So we have completed a very important topic today. If you have any doubt, you can comment down in the comment section. I will try to reply them all. And do like, share, and subscribe to my channel for supporting me and my channel. And thank you so much for watching my entire video.